Hello, everyone. Today we're going to talk about what I think when I encounter a patient with elevated blood pressure. And it's a lot more than just looking at one number. The first thing I ask myself is this chronic or situational? One elevated reading doesn't automatically mean someone has hypertension. Things like stress, pain, anxiety, rushing to the appointment, all of this can temporarily raise your blood pressure. So I don't treat a single number. I look at patterns over time. I also think about when the blood pressure was taken. Was it in the morning, after coffee, after smoking or vaping, at the end of a stressful day or a stressful shift for those that worked overnight? Blood pressure
Sure.
changes throughout the day. Timing gives context. So we really need to be paying attention to the time when we're taking the blood pressure. Is it time that you're well rested? Or you just finished some chores at home, or you've been sitting down for a little bit. So we need to think about all that. Also think about what else the body is responding to. How is your sleep pattern, your stress level, nicotine use? Are you having any pain at the moment? How much coffee are you taking? All of these affect the blood pressure. Sometimes it actually does significantly. If we ignore these factors, we miss the real story. I also compare the office readings to the home readings. A lot of times when patients come to the clinic, the blood pressure tends to be elevated. Again, it could be related to several factors. Just driving to the clinic, some just have it elevated because they're anxious, they don't know what they're going to expect at the doctor's office. Some blood pressure will be normal at home, it will be elevated at the doctor's office. So when we put this into consideration, it helps us to make better decision. It doesn't mean that you're doing anything wrong when you check it at home and it's elevated at some point and then it's high is normal at another point. It just often means that the nervous system reacts to medical environments, and that greatly matters when we make those decisions. Before escalating medications, we often ask, have we addressed all these environmental factors or lifestyle changes? Also, things like nutrition, stress, smoking, or vaping needs to be put into consideration. Medication is important, but it is not the only tool. So when I see high blood pressure, I don't think problem. I think, what is the body responding to? Blood pressure is information, and good care starts with understanding the message. If this helped you understand blood pressure differently, please follow us for more health tips. Thank you.